In the UK, things are looking brighter. The nation is emerging from a devastating second wave of COVID-19. The infection rate and death toll are plummeting, and the British government is overseeing an impressive vaccination drive. But for a nation that suffered more than 120,000 deaths, there's a long road to recovery ahead. Fasila Fatima is an intensive care nurse who's seen too much death. At just 26, she's contemplated leaving the profession.
Then it just got so bad that, you just see people just crying in the corridor and you're like, I don't have the emotional strength to be like, you're going to be okay, because I don't even think I'm going to be okay.
Up and down the nation, tens of thousands of people died in ICU wards. At the peak of the third wave, hospitals were at risk of being overwhelmed, and a state of emergency was declared in the British capital. By mid-January, there were almost 40,000 COVID-19 patients in hospital beds across the nation, and a national health service that had been pared back over decades was struggling to cope.
I think when my colleagues were breaking down, I just couldn't say anything to them because I didn't have it in me. I didn't have it in me for myself, let alone for anyone else. I was just like, I don't know what to say.
At the moment, it's very difficult. We're trying our very best and leaning each other on support all the time. But it's gotten to a point where we're just so physically exhausted.
Amira Sheikh is also an intensive care unit nurse and, like Fasila, a union representative at a major London hospital. She finds some patients hard to forget.
Well, recently, I've actually been looking after a lot of pregnant women who are in the intensive care units, very unwell. There's a lot of postpartum women as well. They all have such young families or just starting out in their lives. And it's really sad to see little children coming in to say goodbye to their mum or their dad. And you kind of just have to hold on for a little while longer until the end of your shift.
Across the NHS, there are stories of trauma. In January, a King's College study found nearly half of more than 700 critical staff surveyed reported symptoms of post-traumatic stress disorder, including severe depression and anxiety. Psychologists say the care they receive in the months ahead will be vital.
We need to do the same as we do for veterans, actually. So military veterans in the UK are entitled to what's called priority care, and that's part of the military covenant. And the military covenant says that if you have served your country and you have become damaged because of that, you are entitled to have better care because you have been damaged because of what you've done for your country.
The painting came about because I felt something needed to be done. I wanted to make some sort of a record or a snapshot in time of 2020.
With paint on canvas, British artist Heath Rosselli captured the pressure inside an ICU ward in the city of Cambridge. In the foreground is anaesthetist Dr. Andrew Johnson.
Dr. Johnson said to me when I first started talking to him that 60% at that point in time, 60% of the people he was putting on a ventilator would not wake up again. And he felt, terrible that he was probably the last person that they would see ever. And, that rather explains the way he's looking.
While the pressure is easing, there remains about 16,000 COVID-19 patients in hospital, meaning for now, time for reflection for ICU medics like Amira will need to wait.
I think a lot of people are very suicidal, they're very depressed, they're very anxious, and they don't know how to handle their emotions and feelings. And there's a lot of people that are having breakdowns even at work and being sent home in the middle of the shift because they simply cannot cope.
Priscilla has decided to keep nursing, but knows the months ahead won't be easy.
It always hits you later. Because if you think about all the people that you're losing or all the families that you're having to speak to, you can't do your job properly. You just can't. You're looking after so many patients.
And if that story's raised any issues for you, you can call Lifeline on 13 11 14 or Beyond Blue on 1300 22 46 36. Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.